Hello, good afternoon. My name is Ankush. Today I would like to introduce Dr. Gurpreet Sing Brar, Professor and Head Surgical Oncology, DMCH Cancer Care Center, American Oncology Institute, Ludhiana. Today we will gather some information about head and neck cancer surgeries. So, welcome, sir. Good afternoon.
Thank you.
So, sir, my first question is what is head and neck cancer surgery and what are the different type of head and neck cancer surgeries?
When we talk about head and neck, it covers various sites, including starting from lip to the larynx. So we may have a cancer of the lip, we may have to have a cancer of the inner lining, that is buccal mucosa, we may have the cancer of the alveolus, we may have cancer of the tongue, we may have cancer of the floor of mouth, we may have external also the skin cancer of the face. Then going to what is we call as throat or voice box. So there we can have a cancer of the larynx. For all these sites, we have different surgeries depending on the site of the cancer. So usually wherever there is in oral cavity, there is a local wide excision of any type with neck dissection. And if it is larynx, then it has to be a laryngectomy, it may be partial or it may be total laryngectomy with neck dissection.
Okay, sir. Sir, so what are the risks and benefits of head and neck cancer surgeries?
Usually, there is not much risk in head and neck surgeries. Most of because it being a superficial cancer, so we can very well assess very well before taking up the patient for surgery. So usually there should not be any much risk if the patient selection is proper. And that's it can be done.
Okay, sir. Sir, how does it take to recover head and neck cancer surgeries?
Oh, but it again depends on which part we have done the surgery. So if we have done, say, commandos surgery, it takes, and we have done some reconstruction. So it takes a little longer, maybe 2 weeks to fully recover, or up to 3 weeks to fully recover. If there is some part of infection, it may take a little more also. Laryngectomy, it takes lesser time, but then yes, there is a tracheostomy and that is tracheostome, so that has to mature. Then many times there is a lot of secretions are there from the tracheostomy. That may take little longer. So usually all head and neck cancer surgeries, they take about 12 to 3 to 4 weeks usually for the recovery it takes.
Okay, sir. Sir, so can head and neck cancer surgery affect speech and swallowing?
Oh yes, up to some extent. Especially if you are doing CLS, we have done total laryngectomy, yes, there is total loss of speech. For that, we have some various, modalities like we have a Provox, which we fit into the tracheostome. So that is called artificial, speech is, the patient is not able to speak very well, but yes, he can fairly make you understand and start a conversation. Then we have electronic voice box also. Again, in that also, he can have a conversation. As far as swallowing is concerned, in oral cavity cancer, yes, swallowing is sometimes a problem, especially when after surgery, we give radiotherapy. So there is xerostomia, which is like loss of saliva, the secretions of the mouth because of radiotherapy. So then there may be a little problem swallowing. And sometimes when we have done a total glossectomy, meaning whole of the tongue has been removed. Then also there is some amount of difficulty in swallowing. But over a period of time, patients, they adjust to it. And meaning of course, it cannot be exactly normal, but comes to near normal.
Okay, sir. Sir, what are the long-term effects of head and neck cancer surgeries?
Long term, usually, this, as I've told you, now it depends on the profession of the patient. Supposing the patient has to be, meaning he was a teacher or he has to speak lot. He was a speaker or a teacher or like that profession, then that profession is affected. He has to change that profession because he cannot speak that much. And the same is like when we have done for commando surgery, we have done a reconstructive surgery, and then there is a cosmetic problem is there. Because the face gets some amount of disfigurement, and supposing that patient is a public figure, he or she has to go out in public lot of times. There it will be little embarrassing. Otherwise, it's all right.
Okay, sir. All right. Sir, how is head and neck cancer surgery different from other cancer surgeries?
The main difference in head and neck surgery is the cosmesis. It is a cosmetically challenging surgery because this is the face, and face of person is the presenting part of the body. The most presenting part of the body is the face, and of course speech also. These are the most important parts. So we have to preserve those both things as far as possible. We have to give them the best him or her, the best cosmesis possible. If speech can be preserved, that has to preserve. So that is the biggest difference, and it's the patient can see himself or his surgery daily, that scar which has been done over the reconstruction, because whenever he looks into the mirror, he will always have a glimpse of whatever has been done to him. Whereas in abdomen, any surgery has been done, after patient recovers, there is merely one scar mark, and that patient will rarely see it. So, and it's not viewed publicly also, nobody knows that any surgery has been done. So that way, this is a head and neck surgery, the challenging surgery from the cosmesis point of view, because this is the presenting area. So it has to be as far as possible, the best cosmesis, whatever possible has to be given.
Okay, sir. Sir, can head and neck cancer surgery be combined with other treatment like radiation and chemotherapy?
Oh yes, definitely. It's usually, most of the head and neck cancers, they require radiation therapy, most of them. And sometimes when with the patients which are coming with locally advanced head and neck cancers, no distant metastasis, so there we may give neoadjuvant chemotherapy to decrease the bulk of disease and then operate that patient. So we have radiation is a very important, or I should say additional requirement with the head and neck surgery. Chemo, some patients may require, some may not require.
Okay, sir. Sir, what factors are considered before recommending head and neck cancer surgeries?
Mainly the resectability. Will we be able to resect it completely? Number one. Number two is, after resection, will that defect be closed with any sort of reconstruction with a fairly good cosmesis? So these things have to be kept in mind. If supposedly there is a big cancer of the face or the mouth inside, so you just cannot remove half a mouth over there. So those things have to be taken care of before taking a head and neck surgery.
Okay, sir. Sir, how important is post-operative care for head and neck cancer surgery?
Post-operative, if you have done a tracheostomy, then the tracheostomy care has to be taken. It should not get blocked. Regular cleaning, regular changing of that is there. Then in oral cancer, where we have done a reconstruction, we have to be, initial 24 to 48 hours, we have to be very careful, especially when we have done a free flap, that the flap is viable. While the flap may get congested, sometimes we have to open up the sutures. So especially a free flap has to be monitored regularly. For that, we usually have a help of a reconstructive surgeon, plastic surgeon. So they regularly monitor it, the flap. Even pedicle flap also has to be monitored so that there is no necrosis, the blood supply is there. So initially, once these flaps are taken up, then usually there is no problem. Other thing is oral care we have to take, because the secretions should not get collected in the oral cavity and they may infect the flap. So regular cleaning of the oral cavity has to be done, morning, evening, or maybe more also, depending upon the secretions. That's mainly required, and that's actually in first 1 week it is the most crucial for all this cleaning, keeping the oral cavity clean, the tracheostomy clean. Later on, the things, settle.
Okay. Sir, thank you so much, very much, sir, for sharing important information with all of us. Thank you so much, sir.
Thank you.
Okay, sir.